अस्सलाम वालेकुम स्टूडेंट्स। तो आज हम डिस्कस करते हैं क्रॉनिक इन्फ्लेमेशन को। इट इज़ एन ऑनगोइंग इन्फ्लेमेशन और इसको हम डिफाइन करते हैं एज द डिले, prolonged and more specific response of the body to the persistent injurious stimulus is known as chronic inflammation। और हमारे पास जो acute inflammation होता है it is for shorter duration whereas the chronic inflammation is for the longer duration, and this type of inflammation is characterized by infiltration of the site of injury with mononuclear cell that include lymphocyte, macrophages, and the plasma cell. The macrophages are the most predominant cell of the chronic inflammation, and it also includes the tissue destruction by the inflammatory cell. The tissue destruction is the hallmark of the chronic inflammation, and it also involves the repair of the tissue that occur due to the new vessel proliferation or the angiogenesis and the fibrosis. So the chronic inflammation include both the tissue destruction and the repair of the tissue. Both these processes occur side by side. अब हम बात करते हैं about the cells of the chronic inflammation. So the chronic inflammation include lymphocytes, and these lymphocytes are attracted by the gamma chemokine, that is the lymphotoxin. They also include the monocyte or the macrophages, which are the most dominant cell in the chronic inflammation, and these monocytes are attracted by the chemokine, that is the monocyte chemoattracted protein, and the eosinophil, which are present in parasitic infection. They are attracted by the eutoxin, which is a beta chemokine. And the chronic inflammation also include the plasma cell, which form the antibodies. अब हम बात करते हैं about the causes of the chronic inflammation. So a chronic inflammation occur may be due to a persistent infection, some organisms that are difficult to eradicate from the body, and they persist within the cells or tissues for a longer time, and they lead to the chronic inflammation. The examples include Mycobacterium tuberculosis, which causes TB, and the Treponema pallidum, which causes syphilis, or the parasitic infection like schizostomia, or the fungal infection like blastomycosis. Second is the persistent indigestible material. They may also causes chronic inflammation. These material may be endogenous like necrotic bone tissue, necrotic adipose tissue, or increased uric acid, which lead to the gouty arthritis, and they may be exogenous like ingestion of the inhalation of the silica lead to the silicosis or the asbestos, which causes asbestosis. These are the chronic inflammation may occur due to the immune-mediated reactions, and these reactions may be autoimmune reactions like rheumatoid arthritis, Hashimoto thyroiditis, or the organ transplant rejection, and are the unregulated immune responses that occur in the inflammatory bowel disease. In IBD, there is inappropriate and persistent activation of the immune system of the gut to the bacteria, to the normal bacteria of the gut. And this IBD include the Crohn's disease and the ulcerative colitis. And the autoimmune reaction may include the hypersensitivity reaction, which is the inappropriate response of the body to any antigen, and they may be type 1, type 2, type 3, or type 4 hypersensitivity reaction. Type 1 is IgE mediated, like that occur in the bronchial asthma. Or a chronic inflammation may also follow the acute inflammation when it is not resolved. The chronic inflammation may occur because of the repetitive episode of the acute inflammation, like repetitive attack of acute pancreatitis lead to the chronic pancreatitis. अब हम बात करते हैं about the role of the macrophages in the chronic inflammation. So the macrophages are the predominant cell of the chronic inflammation. The bone marrow, they produces monoblast, and these cells when enters into the blood vessel, they are converted into the monocyte. But when these monocyte they come out of the blood vessel, they become macrophages, and the macrophages they attack at the site of the inflammation by continuous recruitment from the blood vessel. They may proliferate at the site of the inflammation. There is immobilization of the macrophages occur at the site of the chronic inflammation, and this immobilization is due to the migration inhibitor factor that is released by the activated T lymphocytes. So the macrophages attack at the site of the injury due to the recruitment from the blood, proliferation at the site of injury, or immobilization of the macrophages. And these macrophages are activated, and the activated macrophages are known as the epithelial cell, and they are activated due to a tumor necrosis factor released from the helper T cell or the exotoxin. And the activated macrophages then releases destructive agent which causes destruction of the tissue, or they also releases the growth promoting agents which leads to the healing or the repair of the tissue. The destructive agents include reactive oxygen species, nitrous oxide, proteases, coagulation factor, and the arachidonic acid derivatives. And the growth promoting agents that include the growth factors like platelets-derived growth factor, fibroblast growth factor, the tissue growth factor beta, the angiogenic factors like vascular endothelial growth factor that causes proliferation of the endothelial cell and form new blood vessel, and they also include fibrogenic cytokines. And all of these growth factors lead to the healing and the repair of the tissue. अब हम बात करते हैं about the various types of the resident macrophages. And the liver cells, the macrophages are known as Kappa cell, whereas in CNS they are known as microglial cell. In the bone they are known as osteoclast cell, whereas in the lungs they are known as alveolar macrophages or the dust cell. In the connective tissues they are known as histiocytes, whereas in the placenta they are known as Hofbauer cells. In the spleen they are known as littoral cells. In the kidney the macrophages are known as mesangial cells, whereas in the synovium they are known as type 1 या type A lining cell. अब हम बात करते हैं about the subset of these activated macrophages. So these acute macrophages may be the classically activated macrophages, that is M1, or the alternatively activated macrophages are M2 macrophages. So classically activated macrophages are activated by the microbial products and the interferon gamma. And these activated macrophages releases lysosomal enzymes like lysosomal enzyme nitric oxide, interleukin 1, and the interleukin 12. And the classically activated macrophages involved in microbicidal activities and the pathogenic inflammation. And the second one is alternatively activated macrophages, that is M2. These macrophages are activated by microbial products and the cytokines like interleukin 4 and interleukin 5, and these alternatively activated macrophages releases tissue growth factor beta and interleukin 10. And the tissue growth factor beta is involved in tissue repair, whereas the interleukin 10 has anti-inflammatory action. So the classically activated macrophages causes tissue destruction, whereas alternatively activated macrophages is involved in the tissue repair. अब हम आ जाते हैं about the types of the chronic inflammation. So the chronic inflammation may be granulomatous chronic inflammation or the non-granulomatous chronic inflammation. तो सबसे पहले हम बात करते हैं about the granulomatous chronic inflammation. It is a type of the chronic inflammation that is characterized by the formation of epithelioid cell granuloma, and the epithelioid cell are the activated macrophages. अब हमारे साथ granuloma क्या है? तो granuloma is the microscopic aggregation of the epithelioid cell surrounded by a collar of the lymphocyte and the plasma cell. If the granuloma is older, then it is also surrounded by an outermost layer of the fibroblast cell. अब हम आ जाते हैं about the epithelioid cell. So epithelioid cells are the activated macrophages that appear as a larger cell under microscopic examination, and these epithelioid cells resemble the epithelial cell, and these epithelial cells only have secretory function. They releases enzymes like lysosomal enzymes, etc. And these epithelial cells have no phagocytic activity. And these epithelial cells are formed due to the interferon gamma, which is released from the CD4 helper cell. And these interferon gamma, they activate the macrophages and convert them into the larger cell that are known as epithelial cell. And the granuloma have two types. There may be caseating granuloma or the non-caseating granuloma. The caseating granuloma have central necrosis, and it is associated with infectious diseases. Like the example include tuberculosis or the histoplasmosis. And the non-caseating granuloma, they have no central necrosis, and it is associated with the autoimmune disorders like Crohn's disease, ulcerative colitis, sarcoidosis. So this is a diagram of the granuloma, caseating granuloma. They consist of the centrally necrosis, and it is then surrounded by outer layer of a activated macrophages that are known as epithelial cell, and the epithelial cell are then surrounded by an outer layer of the lymphocytes. And if it is an older granuloma, then it consists of the outermost layer of the fibroblast cell. And if it is non-caseating granuloma, then there will be no central necrosis. And the granuloma formation occur in the bacterial infection like Mycobacterium tuberculosis, Mycobacterium leprae, or the fungal infection like histoplasmosis, Cryptococcus pneumoniae, are the parasitic infection like schistosomiasis, are the inorganic metals like inhalation of silicon causes silicosis, are the asbestosis. अब हम बात करते हैं about the giant cell. So the giant cells are the larger cell which have more than one nuclei, and they are formed by the fusion of the activated macrophages or the epithelial cell. When the macrophages they combine, they form the giant cell, and these giant cells have more than one nucleus. And these giant cells may be the Langhans giant cell, which are seen in the TB, and these cells have the nuclei which are arranged in the periphery of the giant cell, and they give the horseshoe shape appearance. दोस्तों हमारे साथ है pound body giant cell. In pound body giant cell, the nuclei are arranged randomly throughout the cytoplasm, and these giant cells may occur due to the suture or the splinters. तीसरा हमारे साथ है Teuton giant cells, which are seen in the pet necrosis or the xanthomas, and they consist of the ring of nuclei surrounded by an outer form of the cytoplasm. चौथा हमारे साथ है physiological giant cell. These type of giant cells are seen in the osteoclast cells, which causes resorption of the bone, the syncytiotocoblast, and the megakaryocyte. In the measles disease, there are Wharton Penkeldy giant cell occur, whereas in Hodgkin's lymphoma, they have Ridge-Steinberg cell occur, which have the old eye appearance of the, and their Hodgkin lymphoma also contain the tumor giant cell. दूसरा हमारे साथ है non-granulomatous chronic inflammation. So it is also a type of the chronic inflammation in which there is no formation of the granuloma occur, and it is characterized by the accumulation of the sensitized lymphocyte, plasma cell, and macrophages in the injured area. But these cells are scattered throughout the tissue and they do not form the granuloma. Hence, in granulomatous inflammation, the activated macrophages, lymphocyte, and plasma cell, they are distributed randomly, or they are scattered in the cytoplasm, and hence they do not form granuloma. The causes include the chronic viral infection like chronic viral hepatitis, chronic autoimmune diseases like rheumatoid arthritis or Hashimoto thyroiditis, chronic chemical intoxication like chronic liver, alcoholic liver diseases or chronic alcoholic pancreatitis, allergic inflammation like allergic dermatitis or the allergic nasal polyp, which is an edematous mucosal swelling of the lining of the nose. अब आखिर में हम बात करते हैं about the morphological features of the chronic inflammation. So they include the macroscopic feature, which are the gross features, and the microscopic feature. The macroscopic feature may be due to the tissue destruction or due to the fibrosis, and the tissue destruction include the ulcer formation that occur due to the epithelial cell erosion, or the cavity lesion occur due to the parenchymal tissue involvement that occur in the lung diseases. There may be the chronic abscess formation occur, which is surrounded by an outer pyogenic membrane. They may include sinus formation or the fistula formation, and due to the fibrosis, the features include thickening of the wall that lead to the structure formation like esophageal structure, or they may also involve the distortion of the organ, and this distortion of the organ occur due to the fibrosis, and the fibrous tissue tend to contract due to the epithelial cell, which tends to reduce the size of the organ, and hence it leads to the distortion of the organ. Then the microscopic features include mononuclear cell infiltration that include macrophages, lymphocytes, and the eosinophil and the parasitic infection. They also include tissue necrosis, tissue regeneration, fibrosis, and the granuloma formation, which have the multinucleated giant cell surrounded by an outer layer of the lymphocyte or the T helper cell.